schools, they are closed for 2 weeks beginning today. County Executive Steve Bellone made that announcement yesterday.
Yeah, so the Long Island County dealing with a growing number of coronavirus cases, a total of 47 at last count. County Executive Steve Bellone joins us live via on the phone, in fact, I understand. So first of all, help us understand what made you make this call to close the schools. I know a lot of other cities are doing that, but what caused you to do so?
One of the things that I've consistently been talking about is this is obviously a rapidly moving situation. Just think about how far we have come in terms of changes to our lifestyle in the last 5 days. And, you know, the numbers you mentioned, 47. Actually, the number this morning is 60. The numbers are climbing.
How many?
And as we're ramping
60.
up testing, we're going to see those numbers continue to climb as a result. So we've been talking about school closures for the last few days, but we wanted to make sure that we had those issues addressed around childcare particularly, but meals also for kids. You know, we have to make sure that we're keeping healthcare workers and first responders, you know, those who are on the front lines fighting to contain this virus, that we're keeping them working. And so, you know, we work to address those issues with the school superintendents, and the schools have been terrific in working to cooperate with us to make sure that we have those things online.
Hey, very quickly, I just want to clarify. You said the number has changed. It's 60 this morning?
It's in the overnight up to 60 now.
So when you say that number is 60, right, how many of those people are in the hospital and how many of those people are actually quarantined inside their home? And what are the hospitals doing? Because that's now the focus and the shift, or how hospitals are preparing for an influx of patients as we continue to see the numbers go up.
That's right. I don't have a breakdown between the hospital and home. A number of them are hospitalized, but others are on home mandatory quarantine at this point. And that is going to be the big concern moving forward now with hospitals and how they are able to handle what may be a flood of new patients coming into the hospital.
Are there any specific areas in Suffolk County? We heard the governor talk this weekend about transforming other kinds of buildings into hospital-like structures that can handle an influx of patients. Any preparations being made in specific areas of Suffolk County?
Yeah, I will tell you those discussions are happening right now, and this week we should start to have more specific plans in place for that. But those preparations are beginning because that's where we may be headed, and we have to be, and that's why we're doing long-term planning here, because we don't know how long this is going to go on for, but we are preparing for what could be a long battle here.
Well, what do you have planned for those who do have to go to work momentarily, right? And for those kids who are now not in school?
So the message we keep communicating, look, because none of these decisions that you make, people should understand, they're not black or white decisions. There's always trade-offs and costs and benefits, and you have to make a decision on balance, what's the best thing to do, basing it on science. But we're messaging to parents, you know, the fact that kids are home, this is not a time to bring kids together in mass gatherings. You know, we need to keep social distancing, practicing those social distancing, following that guidance, because, you know, while fortunately kids have not been particularly vulnerable to this virus, they can carry it and pass it to others. And we have to do what we can to contain the virus, and that means keeping kids apart, practicing social distancing. Do not bring kids together in mass gatherings while they're home from school. Limit those play dates, and when kids are together, practice those social distancing, following those guidelines.
I think a lot of people at home right now are saying, okay, well, now I'm at home with my children. What is the timeline here, right? So how long will school actually be out? And for the business side of things, how long will they be closed? And a lot of places are doing takeout only.
That's a great question. There's a lot of uncertainty here. Obviously, we're in uncharted waters. This is an unprecedented situation. That's why I've always favored a measured approach.
Yeah.
I think, you know, closing the schools for 2 weeks, giving us time to see testing ramped up, you know, give us a much better sense of where we're at with the numbers. That approach makes sense. Let's see where we are as we approach those 2 weeks. If we need to extend it, we will do that. And I think that measured approach is what makes sense because there is so much uncertainty here.
So for now, it's 2 weeks. That could be extended at another possible time, but it's a wait and see. Thank you for joining us with the update. Again, 60 people testing positive.